This webinar is part of the AHEM project suite of resources for Canada's Livestock Association staff, board members, and producers. The AHEM project is managed through the National Farmed Animal Health and Welfare Council. The council also houses the National Farm Animal Care Council, which is a division, they manage the development of Canada's codes of practice for the care and handling of farm animals. The other division is the Canadian Animal Health Surveillance System. This division advises on national animal health surveillance priorities and disease patterns. And the other project under the council is the Canadian Livestock Transport Training Program, which provides training and support services for livestock truckers, shippers, and receivers. And here you'll see just a quick overview of our team. Me and Matt Taylor are the co-managers. Bob Burton is our lead on protocol development. Todd Bergen-Henningowen is our resource development lead. Gina Teal leads on awareness. And then I also lead on the activity 4, which is veterinarian training. And then we have Ron Barker, Amanda, and Sarah. They offer support to the project as well. This slide shows the areas in which we work. So our activity 1, this is our agenda. So this will give you an overview of what we're going to be doing today. So we'll talk about the lessons learned from COVID that would impact our response to a serious animal disease outbreak. And that will be presented by Dr. Krista Houghton. And then Matt Taylor, our co-manager of the project, is going to present on basic tools used for consistent success that we can expect to use in a serious animal disease outbreak like ASF or the FMD, foot and mouth disease. And then Glenn Dreiser from the Manitoba Agriculture will lead us through how might some of these apply to movement controls in Canada with a disease like the African swine fever spreading around the world. Then we'll open it up to discussion, and then we'll close up after that. It should take us about an hour. So just quickly, we'll look at the areas in which the AHEM project works. So we have number 1, our first activity is the industry protocols for policy gaps. So we're looking at developing voluntary seized movement, animals in transit, and vaccination, depopulation, and there might be a couple others that we're working on under that activity. Number 2 is our resource development. So here we are developing, working with national groups to develop frameworks. And then we're working with the provincial organization staff to develop plans, and then a producer handbook, and those are all based on animal health emergency management. Number 3 is our awareness. So this is webinars like we're doing right now. We also have an incident command system or incident management system webinar that's tailored towards industry staff, board executive. And we also have a producer awareness workshop that we put on. We try to run our workshops every week at about the same time. So that's Tuesday at 1 p.m. Mountain. And then we also have awareness tools, brochures, that sort of things that we give out to producers to help them in preparing for and responding to a serious animal disease outbreak. The 4th activity is training for private practitioners. So these are all online. Right now we're running we will be running a foreign animal disease lecture series in January. So if there are any vets on the call who would like to check that out, just go over to our website. They are running, there's 5 sessions that run in January 2021. And then we are working with the CFIA, CBMA, and the EU FMD Commission on ASF and FMD training. So in May, June, we are working on having an African swine fever training session. And in October of 2021, there'll be a foot and mouth disease online training available. So the 5th activity that we've just added is the African swine fever response plan. So we are supporting development of a national integrated industry and government ASF response plan. And our 6th activity that has just been added is working on the foot and mouth disease strategy. So supporting industry and governments in developing a multi-commodity FMD response strategy. So now I think we will turn our webinar over to our first presenter, and I'm just going to, Krista, are you unmuted?
I am. Can you hear me okay?
Yes, I can hear you, yeah. I'm
Okay.
just gonna switch over to your your presentation, but there we go. Just one moment. All right, can you see that?
Yep, I can.
Super. Thanks, Krista.
Okay, well, thank you very much to the Animal Health Emergency Management team for inviting me to speak to you today. My name is Krista Howden, and I'm a veterinary epidemiologist. And for the last 10 to 15 years, I've been pretty involved with helping the egg industry prepare and respond to foreign animal diseases and emerging animal diseases in Canada. I used to work as an epidemiologist with the Canadian Food Inspection Agency, and now I work primarily to support private industry. But part of the reason I'm speaking to you today is I've had this kind of unique opportunity over the last year to be involved with the COVID-19 pandemic response as an epidemiologist. So essentially working to support the human health side of things. And through that process, I think I've gleaned a lot of lessons learned and kind of common themes that I'm hoping that we can discuss a few of them today and see how we could best apply them to the animal health situation. So next slide. So we'll go over a few of these common themes. I know we only have 10 minutes today, so this is part of a much bigger presentation, but I've tried to pull out 3 of them that I think are probably the most impactful for this group. Talk about some of the lessons learned to date, and then hopefully at the end have some time for questions and discussion. Next slide. So this one is probably no surprise to anyone, but I think that one of the biggest things we've learned from COVID-19 is that human behavior, I wouldn't say it's unpredictable, but in a way it's predictable. We've been able to see that, so many challenges with COVID have been related to just people being confused, people not understanding what's going on, and people making decisions that don't, I guess, put you in the direction that you're trying to go. So what we've realized is that understanding humans is essentially a huge key to getting control of the disease. As we can all appreciate, political factors, economic factors, social culture factors are big players in people's decision-making processes. And until we really start to understand what influences people's behavior, what makes them choose to either comply with a policy or requirement or not comply with it, we're kind of in this gray area. So until this week, we really haven't had any other tools besides influencing people's behavior to get them to respond to the pandemic. Finally, this week, we're getting the rollout of the vaccine in both Canada and the US, but you can see where we've gotten to now in the various places across the world, just based on differences in how people have responded to the measures that put in place to control the pandemic. So this isn't limited to COVID-19, and I think we can draw some parallels to it on the animal health side as well. We know, for example, African swine fever in different countries in Eastern Europe, and in Africa itself, there's a lot of political and financial decisions that impacts people's behavior. So even though they might know or be aware that they have pigs that are not healthy or that they're not doing well, that incentive to get them quickly sold, to move them, to sell them, to get money to feed their family trumps any sort of rational decision-making about controlling a disease. So that's something that we need to consider. And even in our own backyard, we've seen through the various high-path avian influenza outbreaks, when we've looked at producers, beliefs, behaviors, level of knowledge and understanding, there's a lot of things that come out about trust and transparency and just knowledge that are impacting our ability to effectively and efficiently respond to an outbreak. And a good example would be in British Columbia after avian influenza, we asked people to rank or prioritize what they thought were the reasons why they got avian influenza on their farms. And probably it was close to half of the confirmed case premises believe that it was more likely to be an act of God as opposed to a breach in their biosecurity procedures that resulted in entry of avian influenza to their farm. So this tells you that there's a lot of things about people we need to understand. We need to understand their drivers as far as fear and economics are probably the big ones. So next slide. Another one is about vaccines. So vaccines has been all over the news in the last couple of days, but when we're talking about any disease, whether it's a pandemic in people or an animal health emergency, our goal is to be able to effectively and efficiently respond to that outbreak before we get to the stage where we need a vaccine. So essentially, if we have something come into the country, we want to be able to detect it, effectively contain it and manage it and eradicate it before we get to the stage where we would need a vaccine. So people are always asking, where's the vaccine for ASF, or when are we going to get a vaccine? And it's like they have this belief that as soon as we get that vaccine, it's no longer an issue. But vaccination is not always the simple solution that everyone thinks. Especially for a disease like all of our animal diseases. So for COVID-19, now that we do have a vaccine, it's important to understand what we're asking that vaccine to do. So essentially the Pfizer vaccine and the Moderna vaccines that have come out are going to prevent or minimize the occurrence of clinical signs or severe outcomes. But what it doesn't do is prevent transmission of the disease. So if you're in a situation where you're trying to eradicate a disease like we would be with African swine fever or foot and mouth disease or something else, it's very important that you don't have ongoing transmission, and that if animals are sick, you can tell that they're sick, because that's the way that we detect the disease. So there definitely are situations where we would need a vaccine for a rapidly spreading animal disease, but the take-home message is that we want to get to the spot where we don't have to get there. If we were in a worst case scenario with something like foot and mouth disease, where we had lost control of it and we were trying to eradicate it, but our measures weren't working, that's when we get into a stage of having to proactively look at vaccines. And then the question becomes, how do you apply a vaccine and still be able to detect animals that were infected as opposed to those that are vaccinated? And then how do you maintain and reestablish trade after you've used a vaccine? So just to make the point that vaccinations are part of the solution, but they shouldn't be considered the solution, and we shouldn't be sitting back and saying, let's sit back and wait for a vaccine. Next slide. This one's probably no stranger to anyone, and there's probably many of you on the call today that have had to be tested for COVID, but the same pattern exists whether it's a new human disease or an animal disease that's coming up. We need a test, we don't have a test, we're developing a test, we don't have enough tests. Why can only certain people get tested? Where do I get tested? All of these same questions that have come up with COVID are likely to come up with any new disease that we have that's either an emerging disease to Canada or a foreign animal disease. When what we've learned over the last 6 to 12 months is that it's not just an issue of lab capacity. So does the lab have enough space and tests and everything that they need to run those tests, but it's also how can you get the test logistics in terms of getting the sampling done, turnaround times that are fast enough to allow you to impact your decision making and all of these other factors. And what we've really seen is this push and this need to more point of care type testing. I do a lot of work right now looking at outbreaks in continuing care facilities. And some of these sites that are doing prevalence swabbing of all the people in those facilities end up waiting 5 to 6 days to get those results back because they're asymptomatic and it's proactive prevalence screening. And 5 to 6 days doesn't really give you enough. I mean, that's too much of a lag time to give you good information to start making decisions about, whether that person can be transferred to a hospital or whether you can transfer them between floors. And the same parallel applies if you're talking about an animal population. So when you have an outbreak in an area and you're trying to decide, can we safely move pigs or cattle or whatever to a new site or to slaughter, having access to tests with a really quick turnaround is one of the key measures that you're going to get to allow you to have that business continuity that you need to minimize the impacts of an outbreak on industry. So next slide. And this one has come out very strong, and everyone that's involved in agriculture knows this one right now, is that not everyone plays fair or respects science. We've seen some very non-science-based decisions impacting our ability to trade products and export products from Canada related to COVID-19. And we're also seeing similar things happen to Germany in the ASF situation. So in these cases, the whole point of having the SPS agreement and all the WTO requirements for safe trade in animal products is that you have clear science-based recommendations, so that if you've done everything that you should be doing as far as surveillance and testing and making sure those animals are healthy, there should be no issues with trade. But what we've definitely seen with COVID-19 is that there's countries that are choosing to proactively use this disease as a way to put in place non-tariff trade barriers. And so that's something that we're hopefully won't continue over time, but it's definitely been a massive shift over the last year where we've seen a greater amount of non-science-based decision-making when it comes to trade. Next slide. So what can we do? I mean, we only have 10 minutes today to talk about this, but I think the first piece is just trying to understand and really make sure that we've learned as much as we can from what's happening with COVID-19 and bring that forward as we do our pandemic preparedness. So the next slide is something that's no stranger to everyone, and this is what you guys are all a part of today, is that pre-planning and preparation pays dividends. And one of the reasons we're in the bad shape that we are with COVID-19 is a lot of the funding and pandemic preparedness responses that came out of PH1N1 in 2009 were just hitting that 10-year resourcing life cycle. So a lot of the funding had dried up, a lot of the resources, a lot of the stockpiles, a lot of the training and scientific resources that we had in place were no longer there just through attrition and lack of funding. And so now we're in a position of trying to rebuild. So how do we come out of this in a way to develop, I guess, a response plan that's going to be sustainable so that if we don't get ASF or FMD in the next year or two, we still have something that's sustainable over the long term. And this comes down to many pieces. So we have, capability, resources, risk communication, intelligence framework. There's lots of pieces of the puzzle, but what this group is doing today is a key part of that. So next slide. So back to what we were speaking about before, and this one is, I guess, just so drilled in my mind because it's not a lack of diagnostic testing capacity. There is rapid tests available now. It's this finding the balance between, having the regulatory oversight of tests to make sure that you're getting good, high quality tests on the market, but also being able to capture the data from those tests so you know what people's status are and you know how that test is being used. So we have to find this right balance between having scalable capabilities to facilitate rapid and accurate diagnosis without losing track of what people are doing. So with COVID-19 right now, I mean, many people are probably aware you can do a basic lateral flow test and get a pretty good sensitivity on whether you have COVID or don't have COVID. So meaning you could do that at home, just like a pregnancy test. It's getting to that stage. But the challenge becomes the regulatory oversight of that. So how do we learn from this in an animal health space? We've built tremendous lab infrastructure. We have a lot of experts that are working in labs that have that ability. We've talked a lot about scalability and capacity for lab testing, but where we need to take that discussion now is talking about rapid and pen-side tests. And how do we find a way to give the government a high level of assurance that those tests can be used safely, both by industry and government at the point of care, to be able to do things like quickly decide whether animals can move to slaughter safely or can move in or out of a zone safely. And so that's one area where I would challenge the animal health group to start to focus over the next 6 months to year. Next slide. So where do we go from here? With COVID and African swine fever, these are just kind of the two, I guess, viruses du jour, but we know that there's always something lurking around the corner. So the biggest thing is just to be aware of that and be prepared and understand that there's diseases that we know about, foot and mouth disease, African swine fever, highly path AI, those are all on the radar, but we have to think of how we plan for the response in the context of if we have new or emerging diseases that we know nothing about, similar to what happened with COVID. So one of the good things for us is that the diseases that we expect to impact Canada are ones that have been around for a while. So we mentioned high path AI, African swine fever, FMD. Those are diseases that we know quite a lot about. We have a lot of experience from other countries. We have the diagnostics available. We know about their epidemiology. We had the critical tools and the knowledge to be able to respond to them. So there's really no excuse for us to be prepared for that. It's the ones where we have emerging or new disease events that become a little bit more challenging. So we need to be able to structure our response plans in a way that we might not know everything about the disease, but we have the basic tools to be able to respond and the infrastructure is there. And just like what we're doing today is having that governance structure that builds and leverages upon both the qualities in the public world and the private space that can bring together the best of both worlds to get that kind of collective, strong leadership from both sides. And that's the best way to get to the end of job. And then the big one that everyone in the egg industry is no stranger of is at the end of the day, if we have an outbreak of a serious animal disease, we need to have an industry that's left standing at the end of that. So there's got to be this recognition that we need to incorporate economic factors, mental health factors, everything about producers' viability and business continuity to allow us to effectively and efficiently respond to that outbreak, but have an industry that's left at the end of the day. And that's one of the things you can see with COVID, that there's definitely this balancing act between the needs of public health versus the needs of the economy. And hopefully with an animal disease, it wouldn't be as bad in that we can push forward that economic piece a little bit better. But it's important to understand that the role of government in Canada, at least for the Canadian Food Inspection Agency, is to get in there and to rapidly eradicate and respond to that disease. Their mandate kind of ends there, and we're looking to others like Agriculture and Agri-Food Canada, the provinces, territories, other stakeholders in industry to help bridge that gap on the business continuity side, to make sure that we have an industry that's strong after we do have an outbreak. So that's all for me. Thanks, Mickey.
Okay, thanks, Krista. I will just flip us over to Matt's presentation. All right, Matt, are you?
Okay. You've got me?
Yeah, you're good to go. I can hear you.
All right. Well, thanks very much, Mickey and Krista. I think that was an awesome presentation. It's always hard going after someone like that who's A, polished, and B, really has the facts and the information and insights to share. So thank you very much. I'm going to be talking today about the basic tools that have been used with, in my mind, considerable success, obviously not as much as we would like, but considerable success with COVID, and how those translate and how we might see them implemented in a serious animal disease in the livestock industry. So quick test here. You guys are going to have to work for your money. Which of these diseases is the most contagious? And there is an actual measure of contagion. So we've got African swine fever and foot and mouth disease from the livestock industry, and then we've got the common cold and COVID-19. So just quickly click off one of those that you think to be the most contagious. Okay, I think it should be done by now. Mickey, how are we doing there?
Okay, it's coming.
All right. Well, you guys are in for a bit of a surprise here. A number of people noted foot and mouth disease being the most contagious, 32%, and that is correct, actually. On a measure that epidemiologists use called the R0 factor, if there were one infected person in a population of 1,000, we could expect to see, by some studies, in excess of 20 infected people if it were FMD. What's interesting here is people identifying the common cold as being the most contagious, 45% of you. And yet, in reality, the common cold has, and Mickey, if you can just move that poll over to the right, or kill it. Yeah, the common cold has an R0 factor of between 2 and 3. Is perhaps less contagious than COVID-19. ASF, the other disease we're increasingly familiar with in the swine industry for certain, African swine fever, has perhaps the least contagion. There are other aspects of ASF and FMD that make them important, and we'll come to that later. Next slide, please, Mickey. So what do we know about COVID? And again, we hear this all over the news, et cetera. And Krista highlighted a number of these points. But first, it's a new disease. So although we frequently talk about ASF and FMD, it might be, PNQ, for all we know, that's completely different. Certainly COVID, contagious. We would probably say highly contagious by a number of other diseases that we're more used to, and relatively high mortality rate. and until quite recently, no immediate vaccine. Now let's compare that with, for instance, ASF. ASF is a very tenacious disease, so exists quite well outside of a host. Low contagion, as I've just described, also has a low mortality rate in a broad population. But if you get it, if you happen to be the pig that gets it, it's a very high fatality rate. So from that perspective, there is a high mortality rate. Has a high trade impact, but a single commodity only is impacted. FMD, in contrast, moderate tenacity outside the host, highly contagious, more so than ASF and COVID, as I indicated. But it has a relatively low mortality rate in most of the species and a relatively low fatality rate if you do get that, if you happen to be the cow or the sheep that gets it. However, high trade impact, and it's across multiple commodities, so the cost is significant. Mickey, would you like to flip slides? So again, let's just take a guess at what you estimate the cost of a serious animal disease like ASF or FMD were it to occur in the Canadian livestock industry. Take 3 seconds. Okay, and the answer. Next slide. It's actually 50 billion estimated to be the cost of African swine fever were it to occur in the Canadian swine industry. The cost of a outbreak of FMD is estimated in excess of 65 billion. These are 2020 dollars. So, a colossal cost. Next slide, please, Mickey. So looking at observations from COVID-19 in humans, what were the factors that contributed to spread? Well, first, travel for certain. That was a huge factor in the spread from one region to another. Population densities, we've seen where in environments where there was a high density, spread was significantly worse. We've seen where certain cultural or business practices contributed to the spread. And we've also seen the effectiveness of the response and compliance to be something of an issue as well. So how does that, how does that compare with the livestock industry? Well, we've got lots of movements and they're going long distances. And we have, if you look at these maps in the bottom here, which are looking at pigs on the left, I think that's beef cattle in the middle and dairy cattle on the right. We have areas that rival any in the world for densities. So these are two factors that will definitely, if it occurs in one of those high density regions, it's likely to spread. And if it occurs really anywhere in Canada and catches hold, it is likely to spread to other regions within the country. Next, we have business practices that certainly weren't designed with biosecurity in mind. And perhaps that's most noticeable in the beef industry, but certainly noticeable and will be a significant factor in the dairy and swine industries and sheep as well. And lastly, we would always like to think that our response is going to be, just like a well-oiled machine. But, the reality that we've not dealt with a major epidemic in our livestock industry in many years suggests that, as with COVID, we're probably going to fumble a little bit at the start and drop the ball on one or two occasions. And that too will contribute significantly to the spread. Next slide, please, Mickey. So the reality and what we've seen with COVID is that there were a number of, I'll call them go-to tools that were essentially quite effective in terms of dealing with the outbreak. They were successful in bending and then flattening and then turning downward an epidemiological curve. I'm going to go into each of these in a bit more detail, but I think that's the key point of my message, is that certainly at the outset, these are the practices that we need to anticipate we will be implementing. And they do actually have significant impact. They're draconian, they're crude, they're basic, but they do work. The good thing about them is you don't actually have to have 100% compliance. As we've seen with COVID, we would love to have had more compliance perhaps, but we know that compliance was significantly less than 100%, but nonetheless, these tools worked. Next slide, please, Mickey. So what were these tools in more detail, and what's the sort of translated version in the livestock industry? First off, international travel restrictions. Well, we're mostly pretty familiar with the export ban we can anticipate, and we ourselves, Canada, has implemented relative to other countries when they have an outbreak. That's a common practice, and it restricts trade from traveling, restricts the disease from traveling to a different country. We need to anticipate that for probably a year if we have something like ASF or foot and mouth disease. Next, domestic non-essential travel bans within a population. Well, we've been promoting something, and we're hearing governments and even people within industry recognizing that we need to, before government comes up with zoning and more refined and legislatively backed tools that control movement, we need to come out with voluntary cease movements, or what they call them in Australia, a 72-hour standstill. And given the experience of COVID, we're starting to call the non-essential movement ban, or NEMB, not to be confused with NIMBY. But this is where, if it's confirmed to be occurring in a particular herd, the Canadian Chief Veterinary Officer or provincial veterinarian would go to the industry leader and say, we need you to recommend to your producers a non-essential movement ban, and that the industry players would be familiar enough with it that they would know that, okay, with a non-essential movement ban, I'm still allowed to do these certain movements, but I cannot do these movements, and that would help control the spread. Next point, please. Third, there's the whole issue of masking regulations, hand hygiene, physical distancing, et cetera, that we've seen, including the patterns about going through shopping malls, et cetera. I equate this to an elevated risk biosecurity protocol. Now, all the major commodity groups have developed with the CFIA or by themselves, in the case of the swine industry, their own national biosecurity standard. And that's great for steady state, normal, what we might call green operating conditions. But what about when there's an outbreak that occurs, we're in Canada, an outbreak occurs in the States, or we're in Alberta, outbreak occurs in Quebec or Ontario. What would we recommend our producers do in terms of elevated risk biosecurity? Each of our commodity groups needs to have ready to go and push out to our producers an elevated risk biosecurity protocol. Next point. Fourth, the emergency financial support. And this was just absolutely critical to the success of the measures with COVID. Without this, compliance would have been far less. And we know that the same is true in the livestock industry. We also know that the current suite of business risk management tools really was designed for other risks, other hazardous events. We need something designed for a major disease in our livestock industry. We're a major trade dependent livestock industry. And when we have an outbreak, the costs will be huge. So we need to be able to adequately support our producers for a period of time in which we're out of the international market, for a period of time in which they may have to keep on feed animals which have been vaccinated and will have to be slaughtered. All that kind of thing costs money. Next point, please. Next, we have the communications and championing of desired practices. We've all seen our public health officer, whether it's Bonnie Henry or the individual from your own province, how these individuals have been tasked with getting up and saying, this is the technical recommendation you need to do. Yeah, that's my dog snoring. Sorry, folks. This is the technical recommendation you need to do. And then we have the political leader who comes up and says, and we need you to comply. And they put it in the context of what it will do for the economy, et cetera. So in the livestock industry, we can expect those technical messages to be coming from Canada's Chief Veterinary Officer in Ottawa, or our provincial chief provincial veterinary officers. And again, they will need to be championed and supported by our industry leaders, whether it's the chairman of Alberta Beef or Alberta Pork, or the Minister of Agriculture from Manitoba, Ontario. Those are the people that are going to have to support those technical subject matter experts. Next point, please. Last point here. We've seen people with COVID identify themselves. Now, they haven't taken out an ad in the Globe and Mail or anything like that, but they let their neighbors know. They sought help from their neighbors in condos, et cetera. People were buying groceries, et cetera. And certainly, in some instances, there may have been a degree of shunning, et cetera. I think, however, people have become much more accepting of it and understood that these people are doing the right thing. So within the livestock industry, we may need to enable producers to self-disclose to their trade association that they are the individual within Southern Alberta that has got a case, that they communicate that to their provincial association so that their provincial association can take necessary steps to better protect the industry as a whole. Next slide, please, Mickey. So that's the basis of my message to you, and hope we have a chance to have some discussion on that. So I'm going to turn it over to Dr. Glenn Dweiser, who's probably got some more detailed points relative to the things I've spoken of. Thank you.
Thanks. Good afternoon, everyone, and thanks to AHEM for inviting me to speak today. I'm Dr. Glenn Dweiser. I'm an animal health surveillance veterinarian with the province of Manitoba in the Chief Veterinary Office, and also a veterinary epidemiologist. Today, I'm going to speak a little bit about movement controls, and I just want to give a bit of a sense. I'm part of a group in Western Canada that has been in preparedness for diseases such as African swine fever. We have been working with Canadian Food Inspection Agency and the provincial pork boards in Western Canada and the provincial chief veterinary offices in Western Canada to get a good sense regionally and provincially and locally, how would we respond to a particular component of a significant disease? And in this case, of course, it's movement controls. Next slide, Nikki, please. Brief definition of movement controls. I'm not going to go into, you can read it, it's right there. But I want to cover off a bit some key topics that provinces view as a role that they will have in movement controls. Because if we're looking at a foreign animal disease, The regulatory power lies in the hands of Canadian Food Inspection Agency, but that doesn't mean that we should expect them to do it all. It really needs to be a collaborative approach that we work with the provinces, the federal government, and the sector stakeholders to be involved. So for us, and this isn't a complete list, but for us, I view the being prepared with stakeholders by identifying at-risk premises, key movement patterns, and frequent contacts. Making sure we know what existing infrastructure we have, what programs we have, what regulations we might have in our own provincial authorities, and that might even include a sector that may have their own regulatory authority to exercise, and see how that will work to support zoning and movement controls. And as I mentioned earlier, utilize a joint response as much as possible to prioritize critical movements for not just for disease, but I think as most of you on the call will recognize, if we get a foreign animal disease, the disease is just one part of that. The welfare implications of not being able to move animals to slaughter, where we have hundreds, if not thousands, or tens of thousands of animals that will have no place to go because of border closures or disease restrictions. How are we going to manage those? And finally, Matt's already touched on this, but really, I think it's important to emphasize, communicate rapidly and efficiently across all stakeholders. Next slide, please, Nikki. From COVID and COVID-19 and other emergency responses in this province that would include floods, fires, PED as a provincial reportable disease in the swine sector, we have learned a fair bit. And I think one of the things I want to emphasize is that we're not without some tools to work here, and we're not without some approaches that we can really lay out in advance. We might see gaps, and we might have very significant gaps, but that doesn't mean we can't build off what we have already. In things like in diseases like COVID that impacted the human population, there were key issues that needed to be identified and potential outcomes. If a slaughter plant is shut down because there is no, because we have infected staff members and there's no way that pigs can flow into that slaughter plant for a short period of time, it becomes important to try to coordinate and connect and identify the key problems and look for other options to move those pigs. In Manitoba, we saw, as a result of COVID, animals from the east moving all the way across to slaughter plants in the west. That took a bit of coordination, but it happened relatively rapidly because we had a lot of communication across the different provinces and across the different provincial pork boards to make that happen. Another thing that I think is a key point to touch on is to have or build on transparency and trust. One of the best examples I have with that is the Manitoba Coordinated Disease Response that was developed by the Manitoba Pork Council in response to PED. This is a spot where participating producers trusted each other enough to have their lab results basically interpreted and placed on a website so that each person knew what their neighbor's status was. If they were going to move animals back and forth, move equipment back and forth, if that needed to happen, they could have that happen because that level of transparency and trust had been built in. Adaptability and flexibility. Anytime we're dealing with an emerging disease such as COVID-19, the initial approaches may need to drastically change. There's kind of that flippant off-the-cuff statement that you have the plan and be prepared to throw it out the window the minute that the disease hits. There's a little bit of truth to that because it can drastically change depending on the circumstances. And we need to build systems and approaches that have that adaptability and flexibility. And notice, again, I am highlighting frequent and effective communication. Next slide, Nikki. So some of the details, just for some of the things to consider that we have for things like movement controls. Most provinces now have premises identification databases. And there's some key components in there that are important to recognize that we need to understand that will impact controls on movements, such as production types, the maximum capacity of the premises, and the density of particular premises in a given area. The other thing that we have is a lot of understanding about movement patterns or animal movement patterns. And a good example of that is pig trays. That doesn't mean that we need to have, it is certainly valuable to have that information the minute the disease hits, so we know what movements have happened right away. And that's how we think a lot of these think about tracking movements. And it is one of the key things that is important to do when a disease hits. However, when we have a system like PigTrace or other movement tracking systems, we can use that information historically to plan in advance, so we know what the regular animal movement patterns are. The other thing that is relatively simple to think about is seasons. There are particular movements that happen on a livestock operation in any given season, and we know that those are going to need to occur. For example, if we can't apply manure, we could run into environmental situations. So if we identify those in advance and start building a plan around those types of essential movements in advance, then we can at least have a better approach to it. And the final piece that I wanted to touch on here under preparedness was frequent contacts. And many of you would probably, either as producers or having worked with producers, know that that's a piece of information that you end up having to go out to with each and every farm and collect at the time that you have a disease outbreak. Interestingly enough, if there's been large-scale disease outbreaks, provincial or other types of surveillance programs or so on that may have covered this type of activity, there might be some existing information that we can already tap into to set that baseline. And in this province, as a result of PED, we have used that information to get a really good sense of how frequent our feed delivery is going to happen to a swine operation. What are the primary service providers that need to go to a swine operation on a regular basis? And then, of course, we can't forget the secondary service providers, the ones who have really not a lot of understanding about the industry as a whole, but they are regular contacts to it, such as fuel delivery, garbage pickup, people doing barn maintenance, that kind of thing. And I'm not going to suggest to you that we have that across all of our sectors. We just have used the, call it opportunity of provincial disease outbreaks in the swine sector to build that kind of contact understanding that we can use to be prepared for movement controls. Next slide, thank you. So most of us, I think, on the call understand that their zoning is a key criteria that is likely going to be used in most foreign animal disease outbreaks. And the CFIA works very diligently at putting together the criteria around those zones for each individual disease and each sector. They're very complex and they can change because often there's new information about a disease that will come out, including African swine fever, that will change what the type of criteria are. But that's okay. Even just working off the baseline criteria and identifying what those are, and then fitting in the information that I talked about earlier to say, how can we be ready if an outbreak happens to work with different, the different criteria that might occur. So population density is one. Where in a province or in a region, and Matt brought this up as well, do we have high risk premises concentrated in close proximity? Management practices, also another key feature. I won't touch on that. Matt already spoke about it. Sector resources, such as transport hubs, packing plants, wash stations, etc. Where are those located? Where are they located and how many of them do we have in a given area? And then we can't forget about environmental factors. What seasonal impacts might happen in a given region if it's winter versus spring versus summer? Where, if we have to do mass depopulations, are our best disposal locations? Do soil types impact that? Can we access dumps or other areas to use as mass disposal locations? And in the disease such as ASF, of course, we're concerned about wild or feral pigs. Next slide, please, Nikki. So just a couple of key things to touch on as well. We need to be thinking about structured emergency response plans that include things such as incident command system response, and Matt touched on that a little bit. I won't go into a lot of detail here. one of the things that we found, whether that be for surveillance or disease response or movement controls or anything like that, is identify what the baseline information is needed. And that's a minimum data set in our terminology, so that we have that in front ready to go in case we get hit by a foreign animal disease. Utilize existing systems and agreements where possible. In Manitoba, we have a somewhat archaic but still useful decision support system for animal emergencies. This allows us to map on the fly where premises might be. It allows us to create biosecure routing if that's needed. We can lay zones on top of that. It's a very valuable tool, and it's, you know, not every province has it, but some provinces have other systems that will work equally well or do a better job doing something else. But identifying those in advance and being ready to use them when possible. The final two things that I want to touch on is identify information and communication gaps. Know what the gaps are. You might not be able to figure them out right away. We may go into an outbreak with a significant number of gaps, but at least if we can know what our unknowns are or know what we might be facing, we can have a better chance of solving them down the road. And then my final point is to test specific components and problems to exercise those opportunities as much as possible, and not broad-based exercises, but just even focused ones where you can take specific components and test out and try to do some problem solving where possible. And certainly that's been happening with national and local exercises on foreign animal disease. Next slide, please, Nikki. I have a few other key considerations there. I think I'll just touch briefly on movement prioritization. That it's not just about disease control, it's about animal welfare, the environmental impacts, and potential return to trade. What animals may need to move where, what animals may need to be depopulated. And we need to consider all of these, in my view anyway, consider all of these key pieces when we're trying to prioritize movement. Anyway, that's it for me, and I'll leave it there.
All right, thanks, Glenn. And I think Matt has something he'd like to comment on?
Well, I just wanted to comment. I mean, the livestock industry is just getting started. If you go to any other industry, we have, you know, banking or oil and gas or railway, they've all got years, decades invested in developing plans and developing the capacity and training their staff. We're just getting started. 3 tools that the AHEM project is giving to the industry include plans for provincial associations, setting out key roles for certain staff. On the other end of that, we have producer handbooks that are available for producers, and these are province specific and commodity specific. And an example of the kind of tool that they would have are the non-essential movement ban and the sort of typical exclusions which would be permitted for each commodity. And then lastly, item that we're just developing now, and I see some of the representatives from the national associations on, but we're developing a sort of a framework plan for staff of national associations as well. So those are kind of basic tools by which we're trying to assist the livestock industry and developing the same sort of capacity to respond to a negative event that other sectors, other industries have already done. So I think now if anybody's got any questions, we'd love to hear them.
If you want to unmute and just ask. Linda, you have raised your hand.
There we go.
There you go.
The handbooks that you mentioned, Matt, are any of them on bison?
You got me. We're working on that.
Okay.
We are starting with we've spoken with the Canadian Bison Association and looking to develop a national framework document with them.
Okay.
And on that, I think we'd like to try to develop a producer handbook as well.
We do. There has been a 3-year program that presented with a code of practice for bison producers, and that's probably a preamp into what you're working on there, Matt. But I was just curious if that had evolved further now.
Yeah, And the answer is no, we'd like to work with you. And you nailed it in terms of, we see these tools fitting sort of hand in glove with each commodities producer industry program, quality assurance program. We see
Definitely.
there. It's not going to come about overnight, but 5 years from now, 10 years from now, I would expect our piece would perhaps just be one small piece of the industry's QA program.
Well, anything we can do to help with that, Matt, let us know.
Thanks, Linda.
And all our resources are available on the animalhealth.ca website if you go under the resource tab. Does anyone else have any questions? There was a question earlier about if the presentations are available. And yes, if you just email us and we'll get a copy to you. And this is also being recorded. And so we will have it up for a bit of time as well. Are there any other questions? We're just coming up on the hour here. So yeah, I'd just like to thank you all for participating in the webinar. Our contact details are on the screen if you have any questions or comments. And please visit our website for more details on all the stuff that was we spoke about the AHEM project. And I'd just like to wish you all a Merry Christmas and a relaxed and peaceful holiday season. So thank you so much for participating.
Thank you, Mika.
Thank you.